Hello, everyone. I'm Sherry Rolfing, your host of the ACAP SDoH Showcase, the first by the ACAP SDoH Center for Innovation. The Innovation Center provides a wide array of services that ACAP member health plans can use to advance their work in the field of SDoH. Innovation Center services include a monthly newsletter, topic-specific roundtable calls, an interactive website, SDoH funding opportunities, competitive analyses, an annual meeting, and opportunities like this vendor showcase to learn about SDoH products and services. I'd like to welcome you to our session today presented by BeneLynk. Our presenters will be Kesley Crichton and Sean Libby, and they will be presenting efficient SDoH outreach to drive retention and ROI. But before I turn it over, I have a few housekeeping items. This session, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines. These guidelines can be viewed on our website. We will record today's call and will post it in the slide deck on the SDoH Showcase website. Always remember, if your plan is seeking services, be sure to check out our list of preferred vendors, where you'll find vendors just like BeneLynk on our website. Look at the top of our homepage, click on preferred vendors, and you can also post a note or even an RFP on the preferred vendor connection portal. During today's session, you can ask a question at any time by clicking the Q&A on the Zoom window and typing your question in. All questions will be answered at the end of the presentation. Now I'll pass it over to Kesley to kick this off.
Thanks, Sherry. Good morning, everybody. So thank you for taking the time to speak with us today. We really appreciate the opportunity to share our experiences with SDoH solutions and what we've been doing with Medicare and managed Medicaid plans for over 2 decades now. I'm joined by our president and founder, Sean Libby, and he'll introduce himself here shortly as well. But we want to really kind of kick this off. And so please use the Q&A not only to ask questions, but as we go through this and we start talking about the challenges and opportunities, we're really interested in learning what you want. And we're flexible, we're innovative, but we'd like your feedback on some of these topics as well. So please don't be shy. So today we're going to share with you our SDoH strategy. And for more than 20 years, I've worked with Medicare and Medicaid health plans, really looking for developing member-centric solutions that also have a positive impact for our health plan clients, mostly around risk and quality. And I know everybody wants an SDoH strategy. If you already have one, you might be looking to tweak that. It's trendy. Your state might require it. Perhaps you have a DSNP and you're looking at CMS requirements coming down the path. And intuitively, we all know it makes sense, right? But does it work, and how are we going to pay for it is what we want to talk about today. And looking at a few ideas that make that efficient for both you and your member and fruitful from that perspective as well. So we're going to give you a quick overview of BeneLynk because Sherry's allowing us to do a little short commercial here, but then we're going to dive in and talk about the program challenges, what the opportunities are, different elements that we believe you can bring together to really make it efficient and to provide some funding so that this is a sustainable program. And then we'll sum it up and answer any other questions you have. So jumping in. BeneLynk, we're a relatively new organization. We've been around since 2016. However, most of us have been working together for 2, even 3 decades. I hate to say that, it ages me. I met Sean over 2 decades ago. His little sister called, or his big sister called me, and I had worked for her for many years, and she asked me if I could hire a little brother, and his sister's pretty smart and hardworking, so I figured why not? So there's a little life lesson in there. Always be nice to your employees because they might end up being your boss. But anyways, fast forward, he's a great boss. Fast forward, we started BeneLynk years ago. We started Social Service Coordinators, SSC. Many of you might have been our clients, and we created the first dual eligible advocacy program back in the day. We also created the first community assistance programs. And way before we heard the term SDoH, it meant nothing to us back in the early 2000s. We did it because it helped our member engagement. It helped give our members that we were calling a reason to share their personal challenges, and then for us to go into more detail, regardless of what we were trying to solve, maybe dual enrollment or reminders for flu shots. Either way, it worked to do and solve for 3 things. increased our engagement to start with a personal conversation, but it also created follow through on whatever we were calling for. And after millions of members and years of outreach, we know that it impacts retention. And it impacts retention regardless of what you're helping them with, was always really interesting. It was more about keeping your name. What have you done for me lately? That generated that brand awareness and brand loyalty that our health plan clients really represented. So today we currently work with Medicare and managed Medicaid plans covering more than 18 million lives in all 50 states plus DC. And I think it's kind of entry level requirements now, but it goes without saying we are high trust certified for our services as well. So I'm not going to read this screen to you, but I want you guys to really think about what your goals are. What's your why for doing this? Is it a state requirement? Does your state require an assessment and for you to surface solutions? What information are you already collecting? Do you have other vendors that maybe are doing home assessments and they're asking some questions or documenting what's going on in that home? What information are you missing? And is there ways to just fill that without asking the same questions over again? Is the format that you're using shareable? Can you share it with your providers? Can they ingest it? Can other business units? So many questions that come up when you're thinking about this. And I think one of the most important ones is, how are you prioritizing? If most of you on this call are from managed Medicaid plans, you know that it's the hardest to reach population out of all our lines of business. We're never going to get to 100%. So what's your priority? Which members do you want to start with for this? And then lastly, how are you going to measure success, and when are you going to measure success? So anybody that wants to put some of their ideas in the Q&A would be appreciated. Thanks. So I'm going to have Sean kick us off to talk about our solutions and the ones that we blend together here. Sean, you want to introduce yourself and review this with us?
Sure. Hi, everybody. Again, I'm Sean Libby. I am the president of BeneLynk and really excited to get a chance to talk with you today. As Kesley sort of teed it up, one of the key components to the way we approach SDoH programs is to have integrated outreach. And for us, that means the ability of an advocate to engage a member in a human-to-human conversation. And then that advocate is empowered to take the conversation in whatever direction the member drives it, so that they're able to provide whatever assistance based on what we're hearing from the member. It really centers the member experience and creates that human-to-human connection. So, and that integrated outreach is designed to drive ROI, right? One of the inherent challenges of SDoH work is that it's hard to quantify the ROI. And that's why we always want to be focusing in particular on programs like recertification of Medicaid members, and also helping people to qualify for SSI Disability as a way to get appropriate premium. So those two programs are two of the ways that when we're having that integrated outreach, we're able to drive a quantifiable ROI. So when we're thinking about this, when you're thinking about how you might be able to do this, it's really important that you have a platform that allows the conversation to flow organically, that you're really able to meet the member where they are, understand what they're concerned with as the starting point. For us, we call that the concept of leading with help. We do that with our community link services, but you want to be able to start with what is the member concerned with, and then look to flow organically to anywhere it needs to go, but in particular, looking at Medicaid renewal and SSI disability as cornerstone pieces. And of course, to do that, you need to be able to engage the member. We really put that human-to-human engagement at the center of the work that we do. But in order to get to that engagement, we really need to be multi-channel. So we need to understand, how does the member choose to be engaged? What's the best way to reach out to them, whether that's SMS or a live agent phone call, what have you, that ultimately will result in that human-to-human conversation that can achieve the integrated outreach that we just talked about.
Great. Thanks, Sean. So we're going to go through some of these in a little bit more detail. And because we do like to lead with help, I thought we'd start with that. And our community link service does just that. It starts with a personal conversation. It's not overly structured. It can be a couple questions, or it can be a full SDoH assessment. But we like to start regardless of what other solution we're offering, right? By having a personal conversation. We not only document those challenges or barriers that the member experiences using ICD-10 Z codes, but we also surface solutions right there within that call. And just kind of going into this a little bit further, we think it's really important to have a good database of community assistance programs. We partner with Find Help. We chose to partner with them because they were very collaborative and even built out some separate program instances for us. We focus on veterans with a different service, and that was really important to us that they were able to do some of that work with us. Sometimes the solution that a member wants help with isn't what their barrier or challenge is. And so that's why it's important to have a large database. A member might be telling you that they're not going to the doctor because they have transportation issues, but that's not what they want to solve for today. Maybe they need help with their kids or even their adult parent that might be living with them. And we like to surface whatever conversation they want and those solutions so that we can keep that member engaged and ultimately get to whatever we're trying to drive them for. And we think reporting is really important, right? So we provide member level detailed reporting that shows the challenges documented with an IC10 or a Z code, as well as the solutions that we help that member to get enrolled in. And this way you can share that across care management with your providers, whatever other business units need to know that this member might be suffering from food insecurity or financial insecurity, and that might impact the way that they are going to deliver care to that member. Oops, hang on, wrong button. There we go. And then, like Sean mentioned, Medicaid retention services, we think is a really important way to kind of start where you're going to prioritize. We can start anywhere, right? But this gives us a jumping off point that's important because you don't want to engage a member that's not going to stay with you. So if we use the renewal dates, which hopefully at the end of this PHE might become more accurate than they have been for the past 3 years, we want to start with that conversation following our community link assistance with them. We think it's important that this be very dynamic, that you know all the information available from that state that you can help educate the member on. If they can get enrolled and do their renewal via mail or email, or if they have to make a phone call, does that state agency have a mobile app that they can do, or even the address? And then we also track the information that we know about that member's renewal, that it's approaching in 25 days, the type of Medicaid, the state they're in, and even to the point of what that state agency refers to. Some states still call it recertification. Most are now calling it an annual renewal, and that you use the same language so it's consistent with the state's outreach as well. In this case, this is one of your ACAP plans that we're getting ready to do some work with in Arizona. And we give the member all the information that they need to do their renewal, both through the mail or fax or online. But then the phone number, if they need assistance, rings back in our shop so that our advocates can assist them. Or in the state of Arizona, they can actually do it through our community partner relationship and do it online right for that member. And this, again, is going to drive that ongoing, enrollment that they have with your plan, because nobody wants to switch plans, right? It's just that sometimes people get busy. This is oftentimes our working poor. They might be working more than one job, and this might be low on their list of priorities, right? But it drives two things. It drives organic growth, which your salespeople and your enrollment people just love, right? Because it's so much easier to keep a member than it is to find new ones. But it also helps that member become more engaged with your plan and more profitable over time, right? So I think it's just a really important component to do with your SDoH program. And then this is Sean's level of expertise. He, when we split off from SSC and we became Altegra Health and Change Healthcare, which is about to become United Healthcare. Sean went and became a disability expert and started a different company. So Sean, can you talk to us about SSI Disability, please?
Sure, absolutely. So as many people know, there's 2 disability programs run by the Social Security Administration, Social Security Disability Insurance and Supplemental Security Income. SSI Disability is the one that is more germane to the Medicaid population, but the 2 programs actually have the same medical standard. You're really proving the same thing, whether it's an adult or a child, in terms of showing that someone is disabled. SSI Disability is one of the most valuable government programs that an individual can receive. A lot of cash benefit inures on a monthly basis from the feds. Sometimes that's supplemented with a further state benefit. And this is generally going to be a lifelong benefit. Most people who are given disability benefits don't experience a continuing disability review to check up on it. So really, really valuable program that some of your members may qualify for, but really, really hard to get the benefit, right? And that's because of a lot of factors relative to the Social Security Administration. Most people doing disability cases have an attorney or a representative helping them to build the case. That's generally not available to members who are applying for SSI disability. So often they're forced to try to do the application process on their own. And that's why it's so wonderful when a Medicaid health plan can be able to allow the members to get a professional advocate to help them get that SSI disability. So what we're looking for is individuals in the household who have a severe medical condition. For an adult, that's a condition that's preventing them from engaging in substantially gainful activity. In other words, it's preventing them from being able to work. For a child, it's a little bit more of a nebulous definition. But basically, we're looking to establish whether or not somebody has that and whether they meet the other criteria for disability. And they're always there. You're always going to find them in a given Medicaid population. And a lot of times you find members who say, yep, I tried to apply for that. A lot of times they'll get to the point where they're going to have a hearing in front of an administrative law judge. It's one of the most challenging parts of the process and really where we see a lot of SSI disability cases fall apart. And that's really the key. If you're going to advocate for members who want to get SSI disability, you need to be prepared to bring them through all levels of application and appeal. So there's the initial level of application. You're going to see somewhere in the neighborhood of 20 to 30% of applications approved. Then there's reconsideration, very, very low approval rate. Typically about 10% of those cases are going to get approved. Then there's a hearing in front of an administrative law judge. And that's really where it's important that the member is represented by an attorney or an eligible for direct pay non-attorney representative, somebody who's been accredited by the Social Security Administration to do this, to make the argument for the member in front of the administrative law judge. And there we see win rates of 60 to 70%. So a lot of disability cases are won at that hearing level. And that's why it's so important that this population that really needs the help has that professional advocate. And it's really wonderful when a Medicaid plan can provide that assistance at no cost to the member.
Great. And there's also positive premium increases too, right?
Yeah, absolutely. So this is, when we talk about this population, they have this disabling condition. Right. So you're looking at individuals in your theoretically healthy population who have the medical conditions that would support a disability application. So from a health perspective, they really look like the population that is in SSI already. So when we're talking about getting the premium adjusted, which is what we're really doing, moving it from, say, a TANF premium to an SSI premium, you see a substantial increase in annual revenue that flows through to you folks, right? Here we have it listed at $7,400, varies quite a bit from state to state. But what we like to emphasize there is that's getting you the appropriate capitation for an individual that you have. Currently, these individuals that have a disabling condition but are in the healthy categories, they're ones where you're probably having medical expenses that far exceed what you're being paid for them. So one of the ways that we can do this, one of the ways that you can pay for an overall SDoH program is to do this disability advocacy, realize this revenue enhancement associated with getting these people this really, really important benefit. And at the same point in time, of course, helping your members to access a benefit that they really need.
Yeah. And it's by far, one of the populations that has more challenges and more SDoH challenges. So not only with the financial enhancement that they receive, but also with you, it ties in nicely to your SDoH program. So I know that this was pretty quick. We want to sum it up. I'm hoping that there's some questions here. But really, when you tie these things together, right, you're really creating a program that becomes self-supporting. So you're going to get a clear understanding of the type of challenges and barriers that your members are experiencing. What we definitely know is that when we help a member with what they're concerned about today, it leads to a better member experience. It leads to improved tenure and stickiness for that member. As that member becomes more engaged with your plan, as you find those SSI members, which aren't going to be a lot, right? But when you have that type of premium enhancement, it's going to pay for a lot of outreach to a lot of other members by gaining that accurate revenue for the risk of all members. It positively impacts your P for P or HEDIS or STARS, depending on what type of plan you have. And over time, you're going to be able to measure lower costs. We know that intuitively it's there. We just got to wait for that empirical data to show up that shows that those assisted members, when we help a person get enrolled in SNAP, and it puts extra dollars that they can apply to food every month, that by all means, it's going to lead to a healthier lifestyle. When you help a member have, their air conditioning on by lowering their utility discounts and so forth, it's going to make a positive impact. We just think that it's very efficient to combine some of these strategies together into one useful program. So we would love to have your questions. We would also love for anybody that's interested to do a deeper dive on any of our services to please email me or give me a call.
So I do see a couple questions pop up.
Great.
First one is, how are you documenting SDoH barriers? I think that's pretty straightforward. So we use the Z codes, and we're a member of the Gravity Project. So we're using Z codes associated with SDoH. We really think it's important that you can't manage what you can't measure. So we want to get systematic whenever we're talking to a member, do that assessment, understand specifically what barriers they have, and then we provide that to our clients on a monthly basis in an extract so that you have categorical, objective information about the SDoH barriers that your members are facing. Okay, there's another one here. Let me see if I can read this. Health plans have many touch points where SDoH needs are assessed. Could you describe your process for engaging a health plan in your system in assessing SDoH needs?
You want to take that, or I can?
Why don't you take that one?
Yeah, so by all means, we can follow whatever prioritization or subgroups that you want us to outreach to. We often use that renewal date as our starting point, and I think that's going to become more applicable next year if the PHE is over. But other times people have prioritized like healthy non-users, people that maybe had that initial claim when they first joined the plan because a provider helped them get enrolled and they're not seeing the value. And so targeting those healthy non-users to get them more engaged in your plan, and not only with the SDoH assessment and the surfacing of those solutions for their challenges, but you can combine some other messages there. Is your goal to get them to do an annual wellness exam or at least an initial PCP visit? So that's kind of a couple of approaches that we've taken. Sean, you got anything to add to that?
That was great. Another question here. You have 3 services, right? SDoH assessment and coordination, Medicaid enrollment and renewal, and disability advocacy. Is this a package or do health plans have choices? So that's a great question. One of our fundamental tenets is flexibility. So certainly we can do whatever you want, right? We'll shape this however you want. But I will say that there's a lot of advantages to doing this all together and having that one integrated call. So one thing, for example, that we do is when we're doing the annual renewal for a member, we want to talk to them, make sure that they have that plan, that we're bringing them through the renewal process. That's a great time to do a little screening for SSI disability, see if there's anybody in the household who has a condition that would support SSI disability. So rather than kind of having these as tunneled programs, you're able to kind of integrate them, have a better member experience, and really take advantage of that engagements that you have with the member.
Yeah, we did focus groups a few years ago, and one of the #1 complaints that our managed Medicaid females had was, why do you call me multiple times just because I have a few kids in my household, right? Like, I don't need 3 flu shot reminders. I don't need 3 renewal reminders. Can, you as my health plan, is what they were referring to. Can you be efficient in your outreach and call me once for everybody in the household? And I think that lesson is applicable here. Like these people they're busy, right? They're struggling to make ends meet and to take care of their kids and so forth. So if we can get them engaged, which is the hardest part, right, is getting that person on the phone, we really want to wrap our arms around them and help them with as many things as they'll allow us to in that one phone call. Great.
A bunch of questions coming across. One of them I saw was how we identifying SSI disability eligible. I think I did just touch on that a little bit, right? So there's lots of different ways you can do it. Where you can run an algorithm to identify people that are likely to be eligible. But really, we find the best way to do that is to have that conversation to really understand the life circumstances of the household. And so that's why we love to tie that to the Medicaid renewal, because that's the time we're having a live conversation anyways. Let's see, next one. What success have you had in engaging non-utilizers?
Yeah, it varies. It varies by population. It varies by plan. We have some, low-income plans up in New York that are very engaged, and sometimes, down south they're a little bit less. I can't always figure out the rhyme or reason, but it's usually around our target is we're shooting for 20% of that unengaged population. Sometimes we meet it, sometimes we don't, sometimes we exceed it. I think that multi-channel outreach is really a key component there, right? I know myself, if you call me, I'm not going to answer my phone right now. I'm on the phone all day long. But if you shoot me a text and it's pertinent to me, I'll probably follow up on that text message. If you send my father an email, he responds to all of them, even the ones with viruses on them, right? So I think it's really kind of pertinent to be able to outreach and then identify what channel is best for that member and be able to measure that success and note it and use it again.
Another one, it's great. So the SDoH interview includes the enrollment and disability assessment function, or is there someone else who does this? I'll take this one. It's all us, right? That's the value of the integrated conversation. Now, if somebody's going to go through a disability application, they're going to get moved over to one of our disability advocates, obviously, but we have the ability to have one conversation and identify all of these opportunities. And then it's all lives within our system. And that we think that's really important, that as we're talking to somebody about their disability application, we understand they need to keep their Medicaid benefits. When we're doing that SDoH assessment, we think it's really important that when you do an assessment, you're also offering help. Otherwise, the member feels mistreated, right? It's really hard to open up about these challenges in many cases. And if you're going to ask people to open up, we think it's really important to be able to say, hey, let's get to work on that right away. So that's why we really believe in this integrated approach where we're able to take that one conversation, take that engagement. As Kesley said, it's really hard to get that engagement. So we do that through a lot of different channels. And then be able to take it wherever the member wants to go, whether it's disability, whether it's Medicaid renewal, or whether it's addressing any really SDoH barrier that's out there. Okay, trying to make sure I got through all of them here. All right, yeah. How do you collect info for the different state Medicaid administrations?
Well, Vicki Jessup is on the call, but and she's really the lead. So we have a team of government relations experts that have helped us to build our eligibility engine for both dual enrollment, SDoH programs, as well as Medicaid renewals. And so thanks to her and her team, we have documented and maintained an eligibility engine for Medicaid renewals in all 50 states. And that's built into our system so that our advocates don't have to know what the requirements in all 50 states are. But if you're in Arizona and you're dealing with access, or you're in Wisconsin and you're dealing with Badger Care or whatever, we try to be as dynamic and as consistent with how that state is speaking to the beneficiaries in that state. She's also an expert in finding all sorts of different Medicaid pathways for our dual eligible members as well. Sorry, Sean, I interrupted you.
That's okay. I see one more question. Sorry. So how did you choose Find Help is basically the question. What I would say is, Kesley touched on a lot of this earlier as to why, we work with them. It starts with the mission. I think their mission as an organization really aligns well with our mission as an organization, really out there first and foremost to help people. And we like that about them. We really love the breadth of their program. So when our agent has a version of Find Help pop right within our Link 360 system, they're able to access programs throughout the country. And I really appreciate the way that Find Help works to partner with those community-based organizations so that when we're reaching somebody, it's not just a Google search, but we're able to refer somebody to a CBO that we have a better understanding of what they can do and how they can help the member. So it's been a long-standing and really wonderful partnership that we have with Find Help.
Right. Well, thank you all for your time. We're done quickly. I know everybody appreciates 30 minutes back. We really appreciate your taking the time to join us today, and I hope to hear from you all. Thank you.
Thanks, everybody.
I want to thank BeneLynk for being part of our ACAP preferred vendor program, actually for quite a while. So I appreciate that. And we like to offer things like this SDoH showcase that really highlights what our vendors can offer. So as a reminder, today's presentation will be recorded or has been recorded and will be stored on the SDoH Innovation Center website for the showcase. And I hope everyone has a good day. Thank you.
Sherry, where's
Yes.
the flyer and the white paper too? Is that on the website?
It will also
as well?
be, yes, there will also be some marketing materials. Thank you, Kesley, for asking. There will be some other materials there as well. And if you think of other questions, feel free to email Kesley and she'll get you the answers.
Great.
Thanks.
Thank you, everybody. Bye-bye.